Well, I'm really excited to be here. I'm Mary, I'm the Women's Health Nurse Practitioner, and I am part of a great team. And Dr. Cavens has created the Matee Breast Center. And I guess how long have we been up at Bloom's? 13 years. And then how lucky are we that now we have Dr. Angela Ware, our breast surgeon, in addition to Dr. Cavens. Dr. Cavens is focusing on lifestyle medicine. It's her passion. And like Dr. Ware alluded to, there really is great research that we can live our lives in a way that can actually reduce our risk for all kinds of cancers, but specifically breast cancer. Oh, let's get on the next picture, please. We have a video. But so technically, 1 in 9 women will get breast cancer in their lives, but about 10% of breast cancer is related to a gene that doesn't work right in the family. So I get to do the hereditary cancer genetic risk assessment, where we look at families and see what the history is and see if there are red flags. And then we do genetic testing. And so we'll turn the lights down. There's just a brief little video, and we're going to put the microphone next to the video. It's 3 minutes.
What is hereditary cancer? A common question when someone is diagnosed with cancer is, why did this happen? Most cancer is sporadic and happens by chance due to a combination of non-genetic factors like age, lifestyle, and environment. About 5 to 10% of cancer is hereditary, meaning it is due to a spelling error or a mutation in a gene. Genes are like a set of instructions that tell our bodies how to grow and function. Certain genes help protect us from developing cancer. However, some people are born with a spelling error in a cancer protection gene that causes that person to have an increased chance of developing certain types of cancer. This does not mean that a person will definitely get cancer. It just places them, and potentially their family members, at a higher than average risk. What is genetic testing, and how can it help? We can use genetic testing to look for spelling errors or mutations in your genes that may increase you or your family members' risk of developing cancer. This can be done on a small sample of blood or saliva. If genetic testing determines that you have a hereditary risk for cancer, this will enable your healthcare providers to make the best possible plan for early detection and prevention. What type of results can I expect from genetic testing? There are 3 types of results from genetic testing. A negative result is the most common and means no harmful spelling errors were found in any of the genes tested. A positive result means you were found to have a spelling error in a gene that we know leads to an increased risk to develop certain types of cancers. With a positive result, your healthcare provider will be able to tell you more specific information about your cancer risks, medical management, and how this may impact your family. For example, potential changes to medical management for early detection and prevention of cancer could include earlier or more frequent screening, certain medications, or preventive surgery. The third possible result is called a variant of unknown significance, or VUS. This means a change was found that may or may not impact your cancer risks. This is not a positive result and should not be used to change your medical management.
So there you have it in a nutshell about what genetic testing is. And we passed around a pamphlet, and on the pamphlet is a QR code. And you can use the QR code, and it will take you to a test, and you can fill it out, and it helps you understand, are you a candidate for genetic testing or not? And Kathy sees these results, and we'll contact you if you are a candidate to see if you would be interested in having an appointment to review your family history and talk about having genetic testing. I think when you finish the survey, it does say you don't have any risk or you do have a risk, so you'll know at the end of the survey. But I know it's been a great day here, and I know also there's some prizes to be given, so I'm just going to ask, does anybody have any general questions about risk assessment and genetic testing? You're ready for the prizes? Well, thank you all for coming out.
Thank you.
Okay, ladies, I know you can do way better than that. Let's give these ladies many other things to do, but they joined us, so that's awesome. So before we get started with the prizes, we have one thing. I have one question. Before you go and have to visit these ladies, what do you need to do? And I'm going to ask, let me see, a millennial or a Gen Xer. Raise your hand, anybody. What do you need to do first?
Self-exam.
Okay, you're not. Good answer, you're right. Right. Self-exams. So ladies, we have to do that, and we have to be diligent about that and make sure that we do those self-exams. And so if there's a problem, we can what? Catch it early. Exactly. And we know we have our team here to help us, right? Exactly. So we have some cookies for you. They're breast cancer awareness cookies. And we're going to pass those around that you can snack on while we go through these 100 gifts. No. All right. So